Welcome to an AAHRPP educational session on applying for accreditation. AAHRPP offers a day-long workshop at our annual conference on how to apply for accreditation. In 2020, because of the COVID-19 public health emergency, we are providing this pre-conference workshop through a series of videos. In recognition of these unusual circumstances, we're providing these videos free as a resource to the community. We are extremely grateful for our presenters from the conference who were excited to move forward and provide education through videos. We thank all of them for generously devoting their time and extensive experience. I will now turn it over to Courtney Jarboe from the University of Minnesota and Robert Hood from AAHRPP.
Thank you. For today's presentation, neither of us have relevant disclosures. And as we get started, let's talk a little bit about AAHRPP's expectations. Now, AAHRPP is committed to high quality programs and reasonable standards, but we want you to think about how organizations have met the standards in a reasonable way. And in some cases, there are organizations that have gone above and beyond and may have been noted by AAHRPP as a program where they have strengths in a particular standard or an area of distinction, where they've adopted additional best practices, innovative ideas, or strong leadership in protecting participants above and beyond those baseline expectations. So this particular standard relates to how an organization responds to concerns of research participants. It's broken down into 3 elements, which we'll go into greater detail. But each one focuses on an organization's process for responding to participant questions and concerns, the education that's provided for research participants, as well as community engagement in their research enterprise. So again, we'll go through each of these on how an institution has met those baseline expectations or perhaps even exceeded those expectations. Now, as you begin this evaluation process, it's really important to look beyond your IRB or HRPP office. Often it is the case that the standard might be met by another group or unit within an organization. So for example, in terms of supporting participants through asking questions or providing feedback about research projects, there may be patient advocate groups or patient support groups, or maybe even a community advisory board on a particular type or topic of research, such as HIV or oncology. Now think about too, even if you have all of these other groups gathering feedback or obtaining or receiving questions from research participants, how do those groups communicate across each other to the IRB or HRPP office? Is there a relationship there where the questions or concerns can be communicated across? So for example, I experienced a situation where a question came into an equal opportunity office. Now the question would be, did that equal opportunity office know that they could contact the IRB or HRPP office for this particular research participant question? And in our case, they did, because we already had that relationship there. So here are some examples of how other organizations have met the baseline expectations for this particular standard. So for example, in the consent form, often there is a section that indicates who to contact if a participant has questions or concerns. And it might be the IRB office, it could be a participant contact line, or maybe a post-approval review group phone number. Or they might also include a web-based feedback form that's available on the IRB website. If they have an HRPP website, they also might have contact information there. So that's kind of the baseline of the expectation for this standard. Now, certainly there are best practices in this area. For example, some institutions have a dedicated phone line. They might also have a systematic survey that is offered to research participants to gather information about their research experience, or contact cards. They might have a small business card that's offered to a participant when they enroll in a study. So if they had questions or concerns, they knew who to contact. Some organizations might have what they call a participant advocate team. They have a primary role in supporting participants as advocates. And then also some institutions, especially universities, have kind of a third-party report service that's offered. That might be another avenue to communicate problems, questions, or concerns as a research participant. So in thinking about those examples, as you look at your own organization, what I want you to do is to think about, where is that contact information located? Who manages the communication channel? So if there's a phone number, who answers it? Is it safe, confidential? Is it reliable? What happens when that complaint or a question or a concern comes up? How is it handled, and who's notified if a complaint is received or resolved? These are all things that generally there's probably an answer to it. It just might not be documented. So you want to make sure they're able to provide that information as to what the process looks like. So here's a great example from the University of Louisville. They have a dedicated phone line for research participants if they have questions, complaints, or concerns. It's also located in the study's consent form. And then it also kind of addresses, if you want to provide this in a more confidential way, here's another opportunity for you to do that. It's a 24-hour hotline that's offered by a third-party service outside of the institution. These are all different ways that this particular university has addressed this. So now as we move forward, I want to hand it off to Robert to talk about the next element.
Thanks, Courtney. Element 1.4b includes education for current research participants, prospective participants, and the general public. This element focuses on activities across the entire HRPP. So in addition to your IRB office, be open to ways of integrating other parts of your organization into your HRPP. For example, your public relations or media relations department may already highlight your organization's research and may be interested in knowing more about how they can be involved. To assess education for current participants, you might poll researchers to identify how they provide education and to identify innovative practices. Also, evaluate education for prospective participants. Again, consider polling researchers, but also look for patient support groups for patients who are being treated and who are considering or have decided to participate in research. And consider education for the general public. Many organizations provide basic information on a website, but many organizations go beyond this and look at ways of learning together with the community about how the community views research. In particular, look for ways your organization works with communities historically underrepresented in clinical trials and research. Next, let's talk about things your organization can do. If your self-assessment identifies you're not yet engaged in outreach, or you've identified some opportunities for improvement, then at a minimum, you could start by providing links to existing materials, such as OHRP's brochures and other websites. You can even link to AAHRPP's website, which provides basic information about participating in research. Best practices including working with community partners. Some organizations participate in research days where people from the organization go to community events to talk about research. Other examples can involve creating or working with patient advocacy groups to identify needs and the best ways of providing resources. Next, let's look at some examples and talk about how to evaluate research. AAHRPP expects a periodic evaluation of these outreach activities and that records of the evaluation be retained. Many organizations create a worksheet and schedule annual meetings of staff to evaluate outreach. This lets you keep a record of the good things your organization is doing, as well as to plan improvements. Next, let's turn to ways of including community members in the design and conduct of research itself. Element 1.4c evaluates the organizational commitment to engage community members in the design and conduct of research. Community-based participatory research represents an approach that engages community members in the entire research process, from selection of research priorities and research topics to dissemination of knowledge and integrating the results of research into community change. The concept of community is complex, but is rarely just based on geography. Instead, it can be defined by other factors such as race, sexual orientation, or occupation. For healthcare facilities, it can also be based on patient demographics and disease prevalence, but most often focuses on race and other social determinants of health and how to improve health equity. This approach to research includes a focus on developing capacities of community members to conduct research and empowering communities to use the results of research to make changes that improve the community. This approach involves a long-term commitment of researchers and community partners. Next, let's see where you might find this research. At universities, some places to look include schools of public health and other professional schools where research is commonly conducted at locations in the community. For example, this might include research on health screening for diabetes or heart disease, where the research activities occur at community locations such as health fairs. Also, look for community advisory boards where your researchers may already be involving the community in the design and conduct of research. If your assessment indicates your organization is not yet engaging community members in research, this can still be a topic for education of researchers and the community about ways research can address community needs, including underrepresentation of racial minorities in clinical trials, and how to engage with your community to address social determinants of health, including race. Next, Courtney will talk about some examples.
Thanks, Robert. So if you think about this element and how we want to promote the involvement of community members in the research process, it is often the case that there are outreach efforts already taking place within your organization via departments, units, centers. That's something that you'll want to look into. In addition, the IRB is required to have a community representation from the perspective of a non-scientist or an unaffiliated member. So it'd be good to look at that membership to see who takes that place for the IRB roster. Is that sufficient when we think about community member involvement in the research process? In addition to that, there's best practices. So thinking about training curriculum, do you have training curriculum for community partners? Is it relevant to what they're doing rather than just requiring a kind of a standard IRB training course? Do you offer focused events like a research ethics week or a research participant gratitude event? Do you have community-based groups that are often engaged and involved in the broader research conversation? And again, community-based participatory research is another avenue here. So when we think about the elements in the community involvement, you should ask these questions. You know, in what ways are the community members in your area that you serve already involved in your organization? In what ways are they not involved and should be? So this is an opportunity to potentially grow your organization's community involvement as well. So next steps. When you think about, you know, okay, I got the self-assessment to do, where do I go from here? So you need to first identify what's already in place or available at your organization. So think about procedures, materials, activities. Who are your stakeholders as well outside of the IRB and the AAHRPP? Then from there, identify the gaps. And whatever those gaps are, before you try to reinvent the wheel, look at resources that are already publicly available to you, including written procedures that you can adapt or adopt at your institution. And when we look at evaluating an organization's response to concerns of research participants, one common area of concern is the lack of evaluation of activities to hear from participants or the conduct of outreach and education and engagement of communities in research. So there's something to look at as you evaluate your organization. And thinking about evaluation, it's important to evaluate your response to concerns of research participants in this standard. So think about scheduling a periodic evaluation. Often it's annual. It doesn't need to necessarily be day to day, but have something that makes the most sense for your program, and have those evaluation processes documented. Often it's the case when a site visitor visits an organization, they find out, yeah, you are actually doing some sort of evaluation, but it's just not captured in a way that can be seen in that visit. So again, documentation is always really important. Now, certainly you can go above and beyond that, and some institutions have identified goals or measures to have a benchmark of how they're doing in this area, or they involve a community advisory board or community partners in the process, and as well engage community, engage the community in making improvements or the development of materials. With that, that ends our presentation.
Thank you, Courtney and Robert. We appreciate your involvement. We also appreciate your excellent support for human participant protections and AAHRPP during this difficult time. This concludes this presentation, but please check our website for other videos in our pre-conference series on applying for accreditation.